Well, I'm a diploma grad from St. Anthony's Hospital School of Nursing. I'm a BSN graduate from Oklahoma City University and a master's in nursing graduate from Oklahoma City. And my background, primarily intensive care um, and neonatal intensive care. Self-care is huge. I think they need to really um, practice self-care to help with resilience, to help them cope with the stressors that they have every day, the emotional um, impact of what they do, and and a good balance between the importance of what they do at work versus the stressors in their life. I think they need to practice wellness, you know, mind, body, spirit. Um, I think it's important for nurses to recognize when they're stressed, when they need to um, take some time for themselves. You know, we used to call it mental health days. Call in mental health day. So, but I think that they need to practice do some of that for them to be able to cope well with what their demands are every single day. Well, I think that during this exercise, I think resilience and all of the other components of what we talked about become integrated into your thinking, and hopefully, uh, I personally am able to put things into perspective and to realize what's within my control and what is not, and how I can help myself be more resilient to the things that come about and happen. That what I can control, what I can't control. I think that coping and good coping skills help us be more resilient. Therefore, it gives us a more positive life. I really liked the concept of presence, and I've communicated with Diane a couple of different times. One, I related an experience that I had with presence. And I think that that's what is important, is to be present. And I think so many times people are not present. And you can, when you're talking to someone, you can tell if they're not present. In the environment that nurses are in, and how stressed they can become, and the demands of their whatever workload they have or whatever area that they're working in, I think it's hard to be present. But there are patients who that can make a difference. If they know that that nurse is right there with them, it can make a difference. Now, with me personally, I'll tell you about presence, is that I think that you are more aware of the sounds that are around you, the significance of people and what they say, and how they react to what you say. And I think it helps you be more cognizant of what you say and how you say it, so that whenever you are really there and you're really listening and you're not planning ahead what you're going to say, because you need to really listen to what they're saying, then I think that it improves the quality of my life. Oh yeah, I think I do it all the time anyway. As a faith community nurse, we do a lot of that, and it's in faith community nursing we call it really. We have a practice that's very similar to presence, but it's called theological reflection, and it's looking at daily experiences and occurrences, and what they mean to you, and what your feelings were at the time that you had the experience. It can be a good experience, it can be a bad experience, positive, negative, but we look at that and we try to determine within ourselves what that meant to us. And from a theological standpoint, we try to think, okay, what is the message here? What is God telling us? Or what, and we, sometimes you can take the experience and relate it to perhaps a poem or a song or a picture, and the feelings that maybe you have in regard to those different experiences, and reflect back on what is it, what's the message here, and how is this going to improve my life, or how am I going to take this experience and maybe not only improve my life, but improve the lives of other people that I come in contact with. I sent Diane an email and told her that I really liked the exercise. I thought it was fun. I kind of got accustomed to looking in my text for the text as to what are we gonna do today. And then on some of the text there was another link that you could go and do the actual exercise. You know, like if it was, I don't know, some kind of a I don't know if it was a yoga experience or what. I would like to have had more time maybe to spend on some of the different ones, but I thought it was fun, and I really appreciate the fact that Diane didn't just come in, give us a lecture, and then get back on a plane and fly back to Colorado, and that was it. I think it's awesome that there's different levels to this experience. The fact that she came to the school, she was presented the information. We did the different exercises within the conference time, and then had that 30 days to continue to enjoy that experience, and then to also have that direct link to her. I thought that was good. I thought that was great. I thought it was. I've been a registered nurse for 36 years, and I have been to a lot of conferences, and I've never had anyone have any communication with me or any of my other colleagues after the fact. It's just they come in, they do whatever, they give you a piece of paper, a PowerPoint presentation, they get back on the plane, nice knowing you, off they go. I would highly recommend her.